There are two channels in the Aerosol Assist, a posterior one and an anterior one. The posterior one is where the saliva ejector will be installed. The top vent is called the aerosol removal port. There are variances in the length of the saliva ejectors. Start by spraying water into the posterior channel of the Aerosol Assist to facilitate installation. Then bend the tip of the saliva ejector and install into the posterior channel. Install until you feel a stop. When fully installed, the saliva ejector should measure 30 millimeters in length. Once the saliva ejector is fully installed, pull down to lock into place, but do not grab onto the tip. Instead, grab the saliva ejector closest to the aerosol port and pull down. You can now change the position of the saliva ejector to fit in the most comfortable position for the patient. Press the saliva ejector so that it touches the body of the Aerosol Assist. This position avoids gag reflexes by not touching any gums, teeth, or any other anatomical landmarks. It was designed this way to provide a comfortable position for a majority of patients that is both effortless and repeatable. If a longer length is required, insert fully and visualize the extra length needed by trying it in the mouth. Then pull the correct length following the same instructions, making sure the saliva ejector follows the patient's anatomy and does not go too deep. In the instance of excessive intraoral fluids pooling, adjusting the saliva ejector will be necessary. When properly installed, the saliva ejector is positioned to remove intraoral fluid with minimal contact on tissue, making sure its ports are unobstructed by any anatomy.